Good evening, everyone, and welcome to the new EMEA webinar by Candela. Today, we will talk about GentleMax Pro Plus, maximizing clinical success. GentleMax Pro Plus advantage for patient satisfaction and ROI. The information and photographs contained in the presentation are the property of Candela and its consulting healthcare providers and are provided for global training, educational, and discussion purpose only. Candela Corporation and its affiliates make no representation regarding federal, state, local laws or regulations that might apply to use and operation of these devices. For this reason, please review your country's currency indication for use as provided by the respective regulatory agency. By sharing this information, neither Candela or any of its consulting physicians give you the right to use the information presented. And this content is not intended to be a substitute for prescription of medical advice, diagnosis, or treatment. Treatment considerations are under the discretion of the qualified licensed healthcare professional. Individual healing times, discomfort, treatment results, and satisfaction can vary. By participation in this webinar, you agree not to photograph, reproduce, or distribute any of the information or photographs presented during the webinar. And now we're introducing our moderator, Dr. Konika Patel Schallen. Dr. Konika Patel Schallen practices laser and aesthetic medicine, both at her private clinic, CMA Medicine in Jacksonville, Florida, and at the Candela Institute of Excellence in Marlborough, Massachusetts. She's the medical director and SVP Global Clinic Operations and Candela Medical. Welcome, Dr. Konika, and I leave it to you.
Thank you very much, and thank you everybody for joining. We are really excited to talk to you about the latest in our Gentle series. And today with that, we have our special guest, Professor Firas Al-Niaimi as well, who I'll be introducing a little bit later. But I want to start with just a quick review of what the Gentle Pro series of lasers has been about. It has been really the leader in hair removal for over 25 years, so very, very long-standing worldwide utilization of this technology. It is important technology because it has dual wavelengths, so you can use either a single wavelength or both wavelengths. And it has been a technology because of that that's been able to treat patients of all skin types all over the world, with more hair removal patients treated globally than any other laser provider. With that, also, the effectiveness of the hair removal is really unsurmounted because of the short pulse durations for the treatment of fine residual hair, the ability to have a range of spot sizes for many indications, even beyond hair removal, and also for the ability to protect the skin and maintain comfort with either DCD, dynamic cooling, or ACC air cooling. So many different reasons why this is such an important technology worldwide for hair removal and more. Hair removal is the gateway to a thriving aesthetic practice. We believe that it's one of the major practice revenue generators, and so having a good hair removal laser is very important. It's able to attract new patients of all skin types. It's able to draw in the growing male market, to ensure return visits, which gives you an opportunity to build a relationship with your patients over the course of a year to a year and a half. And it allows practice growth beyond just hair removal, because this is a laser that you can start with and also treat benign pigmentation, have some vascular treatments as well, treat things like wrinkles and onychomycosis and diffuse redness and acne. So many different ways that you can expand your practice. Laser hair, of course, has a high return on investment, and especially when you have additional indications that you can treat, you certainly are able to pay for your device very quickly. The Candela Premier device, the GentleMax Pro Plus, is featured here, as you can see, and it is really a wonderful addition now to the Candela family because it is so powerful. This GentleMax Pro Plus has 28% more alexandrite energy, so that's nearly a third more energy. And that becomes very important when you're using larger spot sizes, to be able to have that energy in the larger spot sizes with the shorter pulse durations. It also has 13% more ND-YAG energy, which gives us just that little bit more capacity in the larger spot sizes. It, of course, has dual wavelength. Pulse durations range from 0.5 milliseconds all the way to 100 milliseconds and are completely adjustable. Higher fluences, faster rep rates to 3 hertz, DCD or ACC skin protection, and it looks great. As I mentioned earlier, with the alexandrite, of course, you have laser hair reduction, but also the treatment of benign pigmented lesions, vascular lesions, and wrinkles. And the Nd:YAG is fantastic for dark skin laser hair reduction, as well as treatment of blue vessels, and also to some degree in the microsecond pulse mode, pigmented lesions, painting with painting technique for wrinkles, and painting technique for clear nail or onychomycosis. This is what this handpiece looks like. It's thin, it's easy to manipulate, it's easy to hold, and you can see that it's very comfortable. This is the distance gauge, which can be replaced, cleaned, and as you see here, it's up to 26 millimeters in spot size. So this allows us to finish the hair removal treatment really, really quickly. I can get through a back in about 4 minutes. It's really a joy to use, and patients find it very comfortable as well. Let's talk a little bit about return on your investment. As we talked about, laser hair removal, of course, is something that generates income and keeps patients coming back to the office so that you can also talk to them about other things that they may be interested in. They have to repeat multiple times. There's a high patient throughput because at 26 and 24 millimeters spot size, it's very, very quick to treat the patient. It's longer for the patient to actually come in and change than it is to actually do the treatment. So it's fantastic. And the 2 wavelengths allow you to do multiple other things. I want to pause here and just show the higher fluences. You want to see that, for example, on the 755, the old 18 millimeter, 3 millisecond spot sizes, you'll see now has 30% more energy. So I tend to use 24 millimeters to 26 millimeter spot sizes, all the way up to 15 joules per centimeter squared. And Firas, you'll talk about this later, I'm sure, but the larger the spot size, the more effective the fluence. And so you might seem to think that 15 joules isn't enough, but honestly, 12, 13 joules gives you great PFE at a 26 millimeter spot size. And so 15 joules is more than enough. And you find that you're using that well into the 4th or 5th treatment session. So it's very, very quick. And the same goes for the 1064. Also, finer hair, as we get into finer hair, it does require shorter pulse durations, and we can go down to 0.5 milliseconds, but our data shows that 0.5 milliseconds really doesn't coagulate the hair follicle. The best and shortest pulse duration is the 2 millisecond pulse duration, and that 2 millisecond pulse duration for fine hair does a very nice job of actually coagulating the follicle, which Candela has owned histology on, and we actually have the proof points for it. And we show that in our clinical studies that there is approximately a 9 to 10% improvement in hair reduction with this shorter pulse duration, and definitely improved patient comfort. This is just an example of the study that we had, and that study was corroborated by a study in Asia. And we found very, very similar 2 millisecond pulse duration reduction of fine hair at about 10% over the 3 millisecond pulse duration. And then finally, these are just the specs on the highest fluences at the shorter pulse durations. So if you're in the market for laser, be very, very careful to look not just at the top spec. You need to make sure that the energy is also correlated to the large spot size, is also correlated to the pulse duration, and is also correlated to the speed. You need to have all of those be optimized. Otherwise, it doesn't really help you to have a high energy, but you've got to use a very, very small spot size. That's not going to be effective. It's not going to be efficient. So make sure you take a look at that if you are evaluating other technologies. The value of the GLX delivery system in driving higher patient throughput, you can see here that you can get up to 9 additional patients with a 26 millimeter spot size if you're using that. So you can go really quite a bit faster. That's a lot more patients that you can come through. And so this is just a general introduction on the GLX that I wanted to present. And with that, I'm going to introduce Professor Firas Al-Niaimi, who is a dear friend and also just a wonderful, wonderful asset and teacher to all of us who use lasers. Thank you so much, Dr. Firas, for joining. You're a renowned dermatologist. You have more than 200 publications, and I don't know how many global presentations. I think 400 is probably shy of the real number. So we're looking forward to seeing you in the States next week at the AAD, and thank you for joining us and sharing your expertise here today.
Thank you very much, Dr. Konika, for the kind introduction. Indeed, it's probably a higher number than 400, but I stopped counting, honestly. I enjoy this very much. I enjoy teaching and sharing my expertise, and particularly with the Candela laser devices. They're such great devices, and like you said, they can be life-changing. So building on from what you already introduced, I'm going to actually expand a bit more on what you have mentioned. So I'm going to cover aspects of laser hair removal, try and give some tips on that, and then more interestingly, perhaps for those who are dermatologists themselves and not necessarily doing laser hair removal but have the device, we'll talk also about some of the other dermatological conditions that we can use the laser for, such as you mentioned, vascular conditions, some of the benign pigmented epidermal lesions. I really like this slide, and always when I talk about GentleMax, I always like to show this slide, because what it shows the heritage and the history of Candela as a laser company in terms of really the innovation and the improvements in the lasers. So you can see that with the Gentle series, what we see today, what's called the GentleMax Pro Plus, is an end product of a very good product that just got better over time. And that is down to the communication between the company and the doctors, such as having a large spot size, short pulse duration, more fluence, all the things that we face in clinical practice that we want improvement on. You showed already the slide, but this essentially shows that we have multiple different spot sizes, a huge range of different spot sizes with the GentleMax Pro Plus. I'm going to pick up on a couple. So we have the 1.5 millimeter spot, which you can see, which is the very small one. And that is particularly a very useful one when we're using the Nd:YAG for facial vessels. Being at a very small spot size means that it's going to be much safer compared to the larger spot sizes, which also includes higher skin types. So if you are contemplating doing some vascular work, particularly facial telangiectasias and vessels, I will strongly recommend the 1.5 millimeter spot. We also have the 3x10 millimeter spot, which I really like for leg vessels. It's a linear elliptical spot size, so that can nicely trace the individual vessels. And you may want to combine that then with a 1.5 or even a 3 millimeter for some of the more larger reticular veins. What's also special about the GentleMax Pro Plus is that you have this unique handpiece for onychomycosis, which is the 5 millimeter spot. So as soon as you attach this 5 millimeter spot size, it automatically gives you the default parameters for onychomycosis. Then you can see you have larger spot sizes for perhaps hair removal, but also many treatments such as rejuvenation, treatment of acne, and as you mentioned, larger spot sizes all the way up to 26 millimeter for laser hair removal. So the larger spot sizes from 18 millimeter or 20 millimeter all the way up to 26 millimeter is mainly really just for laser hair removal. Because like you said, as the spot size increases, the depth of penetration increases, and therefore the efficiency of the fluence is higher. So we don't necessarily need very high fluences with larger spot sizes, but we can get a very efficient effect from our fluids. So the GentleMax Pro Plus, like you said, has two wavelengths in the 755 alexandrite, 1064 Nd:YAG, multiple pulse durations from very short to very large, different spot sizes, and also a patented DCD cooling, which is the dynamic cooling device. So many colleagues who get the GentleMax Pro Plus will say, well, you know, hair removal is great, but is there anything else I can do beyond hair removal? And the answer is absolutely, and please do. because this device can do so much more than fantastic job doing hair removal. So with the alexandrites, we can also treat epidermal pigmented benign lesions, solar lentigos, even flat seborrheic keratosis, vascular lesions, which I'll be talking about, and wrinkles. When it comes to the NDAG, there's actually a longer list of things that we can do. We can also treat vascular lesions, acne, rosacea, rejuvenation, onychomycosis, scars, and I'm going to share some of these examples and we'll give some tips and parameters as well. So let's talk about laser hair removal first. The first laser hair removal device that came in the market was in 1996, which actually is not that terribly long ago. But the first wavelength was a ruby, that was a 694, because the shorter the wavelength, stronger the absorption by melanin. So it was felt that given the fact that the 694 strongly absorbed by melanin, that would be a good wavelength for hair removal. The problem with that is that even the skin types 3 had too much epidermal absorption because of the strong melanin absorption. So that wasn't a great choice. And you can see on the curve that by shifting that wavelength to the 755, we have a perfect sweet spot for good depth of penetration, but still strong melanin absorption. And of course, if you compare that to the diode, for example, well, it is a shorter wavelength compared to the diode, so there's more melanin absorption, but also the crystal of the alexandrite has other abilities, such as, for example, the ability of generating a very short pulse duration with this powerful device. So that particularly becomes useful for the finer hairs where we can use short pulse durations. So now, today in 2025, the gold standard wavelength for laser hair removal in the lighter skin types, so skin types 1 to 3, is the alexandrite 755 nanometer. And the Nd:YAG is the gold standard wavelength for laser hair removal in the higher skin types because it gives us that added advantage of the safety, which also means that we can even treat skin types 6. And we do have patients from Fitzpatrick skin type 6 with hair removal that can be safely treated with an Nd:YAG. This cannot be the case, for example, with a diode. So once again, the 755, strong melanin absorption, good depth of penetration, so it will be suitable for the skin types 1 to 3. The Nd:YAG is very safe all the way up to skin type 6. So what are the key points for successful outcome when we talk about hair removal? And this is important when you're thinking about purchasing a device and starting a laser hair removal business. Well, first of all, the wavelength is important. And I just mentioned that the gold standard wavelength for laser hair removal is the 755, but we also have the 1064 for the higher skin types. Spot size is important too. We want a large spot size, and with a large, really we talk minimum 12 millimeter and above, because you want to have the depth of penetration. The hair follicle is deep. You want a larger spot size so we can get deep. And this is why now with the GentleMax Pro Plus, we have a 26 millimeter spot. So we don't have any issues with the depth of penetration, but we can also treat a larger area much faster. It's also important that you actually have enough power to get a follicular thermal damage, because the early studies on histology showed that there is a critical threshold whereby if you're using too low fluences because you have an underpowered device and you simply cannot generate enough fluence, you're not going to get the biological interaction that you need. With the GentleMax Pro Plus, we have enough power, high power, to generate sufficient high fluences and large spot sizes, and this is why we can get very good long-term hair reduction. Cooling is important also to protect the epidermis, and of course, speed. And with the GentleMax Pro Plus, we can go up to 3 hertz, which is 3 shots a second, which is really fast, considering if you're using a large spot size, such as the 26 millimeter. So you can calculate that we can treat a full body really within minutes. So it saves much more time compared to the other devices when we're talking about laser hair removal, particularly if you have a busy business. So what we need is large spot size with sufficient power to give us a high fluence, short pulse duration, particularly as the hairs become finer, because that is the key, and this is again the key difference between the GentleMax Pro Plus and many of the diodes, is that the diodes simply are underpowered and cannot generate a very short pulse duration to treat the very fine hairs. And of course, we have the speed and the repetition rate. So once again, from the physics point of view, this is very important to appreciate that larger spot sizes give us better depth of penetration, but also we have less wastage of fluence, and therefore using a larger spot sizes, we don't necessarily need to have high fluences because we are wasting less fluence and we get deeper penetration. And like you already once mentioned, Dr. Konika, you just get more efficiency out of that fluence. So it's not just the number we look at. We always look at the fluence in relation to the spot size. And as we increase the spot size, we decrease the fluence, but that doesn't come at the cost of efficiency, because even though we're dealing with lower fluences, there's still higher efficiency. Now, what is unique about this GLX delivery system, which is new and unique to this GentleMax Pro Plus, is the ability to have the 12 to 26 millimeter spot sizes all in one delivery system. So those who are familiar with the GentleMax Pro will know that for the larger spot sizes, you will need a separate delivery system, which can sometimes slow down the clinic if you're very busy. And I have seen that in some colleagues. Now, we can circumvent that now with the GLX handpiece, where you're free to move between 12 to 26 millimeter spot size. So really a huge ergonomic advantage and making laser hair removal much easier. But also the engineering parts in terms of the glass clad fiber has higher fluences. So with this GLX delivery hand system, we simply have more power. And more power equals higher fluences per given spot size, which will relate to better outcomes, particularly as the hairs get finer and we are advancing in the treatments. Many customers are giving great feedback about the GLX handpiece. This is just one of the comments from some of the customers. Okay, so when we talk about laser hair removal, remember it's a number of structures that we are targeting deep in the follicle. So we're targeting the bulge area, which is the insertion area of the erector pylori muscle to the hair shaft. That is an important area because in the bulge we have the stem cells, also the bulb. So we really want a deep volumetric heating of the entire area. And this is why I have to emphasize that larger spot sizes are simply going to work better. So we would recommend starting with the largest possible spot size, particularly for areas with deep hair follicles and thick hairs such as the back and the legs. And you may want to then, on some of the more sensitive areas or on the face, may want to consider somewhat a smaller spot size, such as an 18 or a 15 millimeter, but really for the bread and butter for the full body, larger areas of the body, we would recommend a large spot size, such as those between 22 to 26 millimeter spots. So once again, this is just an illustration that with a larger spot size, we get deeper penetration, even though if you may think that the area that you want to treat is a small area, some of the hairs might be fine, we still want the depth of penetration. Cooling is very important because cooling cools the surface of the skin, and it's important that when we are dealing with a wavelength that is absorbed by melanin, which is in this case both the Nd:YAG and particularly more so with the alexandrite, there can be overheating of the epidermis because that's where the melanin is. So this is why we need to cool. And the DCD is really a fantastic method of cooling because it selectively cools the surface of the skin, allowing for the laser to then get it. So you can see that with cooling, we can preserve the epidermis. Without cooling, we compromise on the epidermis. There are different methods of cooling, such as cold air or contact cooling, but particularly as we get to shorter pulse durations, cryogen spray is superior. So this is once again an important fact that particularly as we are using short pulsations such as the 3 and the 2 millisecond, it is important that we use cryogen because it is particularly useful for the short pulse durations. So this is how we would recommend laser hair removal for the lighter skin types. We would recommend the alexandrite because of the strong melanin absorption given the short wavelength. For the higher skin types, we recommend the Nd:YAG, and that goes all the way up to skin type 6, and that is because of the safety profile. So once again, why GentleMax Pro Plus? GentleMax Pro Plus has the unique wavelengths for hair removal, high power, allowing us to get large spot sizes with sufficient fluence, short pulse durations as short as 2 milliseconds, and adequate cooling. So these are some before and afters of unwanted hair that can very successfully be treated. Hirsutism on the face, and there are many articles showing that this can dramatically improve the quality of life. There are also some unconventional uses of laser hair removal, and that is using laser hair removal not for the intention of unwanted hair, but for medical uses where there is a hair follicle pathology such as pilonidal sinus, becker's nevus, hidradenitis suppurativa. This is one study that showed that when you perform laser hair removal post pilonidal sinus surgery, we get a lower recurrence risk. And it's very well known among dermatologists that laser hair removal can serve as an adjunct in hidradenitis suppurativa, and this can also be safely combined with biologics or systemic therapy. When it comes to ingrown hairs or pseudofolliculitis barbae, laser hair removal is very effective. One thing I would say here is it works well with longer pulse durations. So we would recommend a longer pulse duration, particularly in this case, if we're going to use the Nd:YAG and it's in higher skin types than then we prefer to use long pulse duration anyway. But I do think that extra heat from a longer pulse duration works well, particularly for ingrown hairs. So if you look here, it's not just the ingrown hairs that have cleared, but also this papulonodular reaction as a result of the ingrown hairs. That just cleared as we treated with laser hair removal. Some other examples of ingrown hairs, and sometimes this can be associated with some pigmentation, and as you treat, that will clear too over time. This is one of my patients, and I'm a Mohs surgeon too, and so she had an invasive basal cell carcinoma, and this is post-Mohs, and she saw a colleague plastic surgeon who had to do a forehead flap because that was the most suitable donor site. And the result is that you have then hair-bearing skin on non-hair-bearing skin site. But with laser hair removal, you can see that there's a very good cosmetic outcome. And this is just one example of the use of laser hair removal device, but not just for cosmetic outcome and unwanted hair. In this case, this was very much, a medical condition. And you can see here also that the discoloration, the graying has also improved, which I suspect is all due to the dense hair follicles there. There was also recently a publication, not even on intraoral laser hair removal with flaps. So I'm just trying to give you an idea about all the things possible that you could do with laser hair removal. Anytime there is a hair follicle pathology, you may want to consider using laser hair removal. Let's move on to something else that you can use with the alexandrites, and that is treating vascular lesions. Each time I talk about it, some colleagues will say, oh, I've never heard. I never knew that you can use the alexandrite for vascular. This is actually very interesting because when we talk about hemoglobin, we often just refer to oxyhemoglobin. But what you see in the blue curve is the deoxyhemoglobin. So that's the deoxygenated hemoglobin. And beyond 600 nanometer, you have a preferentially high absorption of the deoxyhemoglobin to the alexandrite wavelength compared to the oxyhemoglobin. And this is why we can use that to our advantage for some of the venols or deoxyhemoglobin-rich vessels. Now, you have that also in the drop-down menu of the device, but I have to stress you also have to remember that the alexandrite as a wavelength is strongly absorbed by melanin, which which is in the epidermis. So this is really just appropriate for the lighter skin types 1 to 3, just like we will do with laser hair removal. This was one of the studies by Rox Anderson on resistant port wine stains. So these are port wine stains that were resistant to pulse dye laser. And as you know, pulse dye laser is and remains the gold standard vascular wavelength for capillary malformations, which include port wine stains. But for those port wine stains who were resistant to the pulse dye laser, the alexandrite was used in a short pulse duration in this case, because we still want purpur as an endpoint, and it worked well, albeit this is an advancement. These are some of the images from the publication from Rox Anderson. And a few years ago, I was involved in a study with colleagues from Vietnam, and we published our work where we compared also the longer pulse duration of the alexandrite compared to the long pulse of an Nd:YAG for leg vessels, and there wasn't a statistically significant difference between the two. So when you have vessels larger than 0.4 millimeter in diameter, so typically they will appear blue, purple, and then larger will appear green. So they will be rich in deoxyhemoglobin, set in the lighter skin types. If you don't have the Nd:YAG, you can consider the alexandrite. Let's move on to benign pigmented lesions with the 755. Once again, as you know, the 755 is strongly absorbed by melanin, which means we can also treat benign epidermal pigmented lesion. And I stress, it has to be benign, so you really need to have the dermatological diagnosis confirmed before treating. And I also have to stress that this is not for dermal pigmentation. This is purely for your sunspots, for your freckles, for the benign epidermal pigments. And the idea is that we can use a short pulse duration as close as to the nanosecond, so we can then get to close to the thermal relaxation time of the melanosomes. So in this case, because we actually are targeting the epidermis where the melanin is, the DCD is switched off. So typically, we will switch off the DCD. We will use the short pulse duration, which is the 3, but in this case, the 2 millisecond with the GentleMax Pro Plus, using fluencies that will give us a clinical endpoint, and that is darkening and some mild frosting. Now, you'll have to balance that against the skin type. So with a higher skin type, up to 3, you may want to just use lower fluency and get more of a subtle endpoint, but certainly for skin types 1 and 2, you can get more of a brisk endpoint. So you can see here that even with the longer pulse durations, it works well, but when we move on to the short pulse duration, the 3 milliseconds, you get very nice clearance. And Sohar, maybe we can get the video here. See, so here you can see that is, if we have, for example, a chest or a décolleté full of sunspots, what you can do is you can put it on a large spot size, such as a 15 millimeter, switch off the DCD, put it on a short pulse duration, 3 milliseconds, and you can start anywhere from 14 up to 18 joule, putting it on a high hertz, and then just do a few passes. And once again, the endpoint is darkening of these epidermal lesions. Thank you, Zahar. So some examples. So this is particularly useful for larger areas, such as the arms or chest, upper back, but even just for a simple lentigo or flat seborrheic keratosis. So here, for example, what you could do, if it's just a lentigo, you can choose the 10 millimeter spots. I like to mark the borders with a white pencil because white color will reflect the light. So you could choose a 10 millimeter, go on the short pulse duration of the 2 or the 3 millisecond, perhaps start with a 22, 24 joule, do a couple of shots, observe the darkening and the frosting, and then of course you can then incrementally increase. For a flat seborrheic keratosis, you do need higher fluences compared to solid lentigo. And then it's just a barrier cream, something like Aquaphor, to use twice daily, and they will typically get darker and then they will fall off. And what you could do is you could do then the combination approach, where you use the this method to treat the larger ones, and then just do the painting mode as we showed earlier in the video with those settings for the entire area. So you can customize it. And I like to treat first the individual ones, then treat the background. Another example where you can just get some brightening, and it's really good for those patients with multiple sunspots and you just want a brightening. And if you don't have the Pico Wave, for example, or our Nautilus IPL device, which does a fantastic job for these lentigos, I must admit, you can use certainly the alexandrite wavelet. Back of the hand works very nicely. And this is one of yours, Dr. Konika, fantastic results. So really, when you see sun damage like this, where you have this, what I call peppering and this epidermal pigment with these lentigos, really the GentleMax would be very good for that. Now, some colleagues will say, when would you use, for example, the PR handpiece? When would you use the alexandrite? So typically, if the contrast is high between the lentigos and the surrounding skin, so you have light skin and very dark lentigos, then I like to use the alexandrite first, because when the contrast is very low and you have low chromophore, that's when you can shift to the PR. So you may want to start with the alexandrite, clear the darker ones, and then when you're left with the lighter ones, you can shift to the PR. So this is again another example, a fantastic result you can see of this just sun damage and the photo damage with these lentigos using the short pulse with the alexandrite. Right, now we'll talk about the Nd:YAG, and actually the Nd:YAG is a very feared wavelength, but if you know how to use it, it's a fantastic wavelength where you can do a lot. So we already mentioned that for the higher skin types, the 4, 5, and 6, we recommend the Nd:YAG for hair removal because of safety, and it works very well. And we will use a longer pulse duration compared to the alexandrite. You can use a short pulse duration with some of the finer hairs, but that's going to be advanced mode and really reserved mode for the skin type 4 rather than the 5 and the 6. But with the Nd:YAG, we can also treat vascular conditions because there is absorption by hemoglobin, and of course we can also treat some of the dermal conditions because it's absorbed by water. And I always say the dermis can be seen as a swimming pool full of water. So these are some of the conditions we can treat. So rosacea, venous lake, venous malformation, hypertrophic components of port wine stain, deep vessels, rejuvenation, and onychomycosis. So this is one example. But like veins, and this is really where I like the 3 by 10 millimeter spot size. I think the 3 by 10 millimeter spot size really is a unique handpiece and spot size for these vessels. So you will have to match the pulse duration to the size of the vessel. So if it's red thin, it's 10 to 20 milliseconds. Sometimes you'll have to do some test patches and see with which pulse duration you get the better results. When it's more blue purple, I like the 30 to 40, and certainly when it's green, it has to be between 40 to 60 milliseconds. So can we get the video, Sohar? And this is just a video showing 3 by 10 millimeter spot size.
The treatment endpoint is spasm and darkening of the vessel. It is also possible that the vessel will disappear momentarily. Once treatment is completed, follow the post-care instructions found in the clinical manual.
Thank you for that. So you could see, well, the beauty of this handpiece is that you can really place the handpiece right on top of the vessel, so the vessel is in the middle there, and it will absorb the energy, and you can be very selective. Some of these thick arterioles, you can also use the Nd:YAG for that. If you look here in this case, you can clearly see these are blue, purple, so this would very much be the territory of Nd:YAG. So here, even though I did say about the 1.5 millimeter spots, that is good for the small red ones. With this purple one, you need to be experienced, but I use it 3 millimeter spots. So we'll be looking at something like 30 milliseconds, and we'll start with 140 joule and really just observe for the endpoints it's always better to start low with effluence and incrementally increase as per response. Acne and diffuse redness, in this case diffuse erythema with even some inflammatory conditions, that could work well. And what works well here is just the painting mode. So you can use anywhere from 8 to 12 millimeter spots. So let's just for ease say 10 millimeter spots, and then you can put it on a 7 or a 10 hertz. Remember, if you put it on a 10 hertz speed, you'll have to move your hand faster, and then anywhere from 7 to 10 joules. And really the idea is that you do multiple passes and you closely observe the skin reaction. You want the erythema, you want the heat. We do recommend an external thermometer getting a temperature of around 40, and that is your endpoint. And you can do 4 to 6 treatments of these 3 to 4 weeks apart. Some other examples, and perhaps we can get the video here, Sohar. So this is a video showing the treatment of the diffuse redness. So once again, this would be something like a 10 millimeter spots, 7 to 10 hertz, 8 joules, and then doing multiple passes. And the end point is going to be erythema, warm feeling. Patient is going to say it's warm, and an external temperature measurement of around 40 degrees. Periorbital veins. Now, I must stress that it's absolutely important here to use corneal shields. So you have to numb the eyes, insert corneal shields, protect the eyes, use a small spot. So here you could use the 3x10 or the 3 millimeter, 30 to 40 millisecond, and once again start low with 140 joule and titrate up based on the response. Temporal veins can also be treated. And venous lakes works very well. So in this case, again, something like a 3 millimeter spots, 40 milliseconds, 160 joule. You want to observe a little bit of a contraction and darkening. And it's very important that you tell the patient that this will take 2 to 4 weeks before it disappears. Because the first week, the venous lake is still going to be there. It might just feel harder. It will take anywhere from 2 to 4 weeks before it disappears. This is a port wine stain with some of the hypertrophic components, and I just wanted to show you the endpoint. So you can see the flat component that's treated with the pulse dye laser, the 595. Once again, that is the gold standard wavelength for capillary malformations. But in the hypertrophic components, you can see where I use the 3 millimeter spot, 30 milliseconds, 150 joule, and you can see that graying and collapse, and that is an acceptable endpoint for this condition, the hypertrophic component of port wine stain. You can also use it for angiokeratomas, and pretty much comparable parameters, and also for acne, sometimes you can do spot treatments. This is a patient who's a higher skin type, who with a keloid scar, and I like to combine my steroid injection with hyaluronidase, but you can also soften these keloids by using low fluence Nd:YAG, so something like a 3 millimeter, 40 milliseconds, and then around 160 joule, or a 6 millimeter, 40 milliseconds, and around 80 to 90 joules. And just do a couple of passes with cooling, you get some softening, and then afterwards you can inject. This is a study that was, it's a very interesting study that was published a few years ago by the Koreans, using a short pulse ratio, so that's in the microsecond domain. And Konika, I always say the GentleMax Pro Plus is 3-in-1. It's alexandrite, it's a long pulse Nd:YAG, and it's a microsecond Nd:YAG. Because I really think the microsecond Nd:YAG does amazing things. So the microsecond Nd:YAG in this case can be used, as you can see, with these parameters that were published, for rejuvenation purposes and improvement of pores.
Absolutely.
They did also biopsies. So the recommendation would be do 5 sessions a month apart. So you do a treatment and you repeat the treatment every month, 5 sessions, and you could see with the biopsies there was improvement in the collagen. And also some nice contouring and lifting. And this can be combined with some of the other technologies and treatments that we have available nowadays. Onychomycosis, now this can also be combined with systemic therapy. We have a specific handpiece for that, which is the 5 millimeter. It's going to give you a short pulse duration, high repetition rate, minimum 100 pulses for the great toe, and anywhere from 50 to 100 for the smaller ones. It can be painful, it can be, but it can also be very gratifying in terms of the outcome. And some would say, well, why would you use the NDI for onychomycosis? And the honest answer is, well, if you look at who gets onychomycosis, in many cases it tends to be the middle-aged patients who may have liver dysfunction, may have some underlying conditions, and long-term antifungal systemic therapy may just simply not be appropriate. So then you have the NDI laser as a very good alternative. So another example. So really, the Gentle Pro series, it's been proven, experienced, it's tried and tested, and it remains globally the #1 laser hair removal platform in the world. But as I just showed you, there is much more that you can do beyond just laser hair removal. It's available in many, many countries around the world. And what is really unique now is that we have this GLX delivery handpiece system. So with that, would like to thank you all. And I think we have some time for some questions.
We sure do. We haven't seen, if anybody has a question, please feel free to put it in the Q&A and we'll be happy to answer them. I think you bring up a really good point, Firas, that it is a third modality with the microsecond Nd:YAG, and it seems to have caught the attention of people lately, the treatments that can be done with microsecond Nd:YAG. But of course, this is something that has always been the case with Gentle, and if you have it, really, I love that you highlighted some of the things that we can use it for.
Absolutely. I mean, the microsecond Nd:YAG just has a different mode of action where it's preferentially targeting the water, but it's having this incremental increase in heat as opposed to the longer pulse durations. And I feel that does change the biology behavior of the skin. The skin feels firmer, tighter, more glowy. We can use it for acne, for rosacea. But when you do this treatment, patients often say that the skin quality is just better. I think we have a few questions.
Yes. So one of the questions is about paradoxical hypertrichosis. What do you think about that? What do you do to prevent it? And do you feel like one of the wavelengths does it more than the other?
So I think I would also like to hear your perspective about it. But I think paradoxical hypertrichosis is a topic that has been well discussed in conferences and has also been published. My view on that is that you have actually two different types of paradoxical hypertrichosis. You have the paradoxical hypertrichosis in the intended treated area. So you're treating an area, let's say you're treating the chin, but you're using really low fluences that in fact you're stimulating hair growth. So when it's paradoxical hypertrichosis on the intended treated area, then often you may just want to check your parameters, and often it's low fluence. As opposed to the other type, which is more in the surrounding area. So to give an example, you're treating the chin, but maybe on the neck there were some fine vellus hairs, and they then grow into terminal hairs. And in that case, it's really important that you pre and post cool the surrounding areas. It tends to be often in patients of Mediterranean, Middle Eastern heritage, sort of like more the skin types 3, with the very finer hairs, particularly on the sides of the face. I don't personally think it's related to one particular wavelength, but I think one has to look at the parameters, getting the decent endpoints, but also pre and post cooling the fine vellus hairs in the vicinity of the treated area. But I'll be very interested to hear your perspective on that, Dr. Konika.
Yeah, no, I absolutely agree with you. And I think that when we treat, especially patients of, skin types 4, 5, 6, and ethnic descents like Mediterranean, Hispanic, Indian, we will tend to use the 1064 more, which is why I think sometimes one might feel that it's associated with 1064 more, but I don't believe that there really is. That's the issue. I agree with you that it's really the undertreating in the area or the adjacent diffusion of heat. So what we typically do is we just hand. It's usually we find it happens on the face because of all those vellus hairs, and so we just hand our patients ice packs before we treat. If they're going to treat around the upper lip or chin, for them to hold while we're getting everything ready, and they keep holding in that area while we treat the area that they've come in to treat, so that the surrounding and adjacent areas stay cool. Absolutely agree.
I think post-treatment cooling is important because, like you say, you often get this dissipation of the heat to the surrounding areas, and that's when you stimulate the hairs. Many colleagues would say, well, they're very nervous about treating, particularly, let's say, in the skin type 3. So they use very, very low fluences. But you also have to remember that if you actually look at the histology studies early on from the 90s, they were very clear in that there is a critical threshold whereby below that, the hair follicle is intact, there's no coagulation, there is no rupturing of the follicle, and at a certain point you start to get the rupturing of the follicle, the coagulation, and the biological effect. So under treating can sometimes be a problem because you're so low in the fluence that you're actually biostimulating. So that could also be a concern.
And what kinds of things do you like to post cool with?
Well, I mean, not everyone necessarily has a Zimmer. I think it's probably easier if you have cooling air. So a Zimmer, then you can just use that, and the patient can just use it for the entire area. But if you don't have access to that, then ice packs would be absolutely appropriate. You will then obviously have to place the ice packs in the right areas. So ice packs or access to cold air, I would say.
Mm-hmm. One trick that actually Jill Weibel taught me is that in her treatment rooms, she has big coolers, like the kind that you take on a picnic. And she's filled them with large cooling packs. And at the beginning of the day, she'll take cool white washed towels, washcloths, and fill those fill the coolers with the washcloths. And so we use those a lot for cooling, and we use those a lot because they're big and they cover a large area and they're very cold and they draw out the heat. And I find it's very nice also to use it, post a Nordless treatment on the décolleté as well. So that was something that we do at the beginning of the day.
Okay, that's very interesting. I learned something new. In some countries, you can get hold of these rollers that are from metal. So again, you can just put them in the fridge, and they will be very cold, and then the patient can just use that roller over the skin to cool the area.
Yeah, and here's an interesting question. I mean, we recommend the Nd:YAG for onychomycosis, and of course the results are very good, but there's multiple other wavelengths that can be used. What do we know about 755 and the use of 755 for onychomycosis?
I think that was discussed once. I think, I have no experience personally with it, with the 755. I do recall that was, I think, discussed once at a meeting. I don't know if you have used it, but some have said that they have used it.
Yeah, no, bulk heating, I think, of course, is done very, very well with the 1064. And so our treatment guidelines are really based on 1064. I've never used the 755 in that type of mode. So it's an interesting question. I know there's some publications that would I'll take a look at it and see what's come up. But really 1064 seems to be generally across devices what the wavelength of choice.
Correct. Also because of the advantage of the penetration. It's interesting about the Alexandrite. I have heard about it, but I must admit it's not something that I have used. What I can tell you, though, that, for example, with the pulse dye laser, because of the limitation with the speed, you are not able to generate that accelerated rise in temperature. Because really, if you look at how we treat onychomycosis, we're using a higher repetition rate, and that is because we want to generate the heat and keep raising the temperature. So I think with the pulse dye laser, that's not a possibility. But fractional ablative laser with drug delivery is something that's also being used.
Yes.
And then
Also,
yeah,
go ahead.
I could see a question about how many treatments for vascular veins on the legs. I usually say minimum 3 sessions. That's what I say. I think the multiple variants there, it depends on the flow in the valves, if they have some underlying venous insufficiency. But I usually tell my patients I'll do a minimum of 3, because even if you clear many of them in one session, you often will find some residual ones, or some of them might close up, but then reopen again. So I typically say 3.
Yes. And what about pulse durations for the higher Fitzpatrick skin types? How do you select your pulse duration?
Yeah, that's interesting. I actually think, I mean, if you're talking about skin type 3 with the Alexandrite, and maybe there's a bit of tanning, so you can select a 10 millisecond. When it comes to the higher skin types and we're treating hair removal, I think for a skin type 4 with a fine hair, you can still test patch on a 10 or even a 5 millisecond. But for a skin type 5, I would go as low as 20 milliseconds, and for a skin type 4, 40 to 30. But that's the way I do it. So 30 to 40 for skin type 6 on the Nd:YAG, 20 milliseconds for the skin type 5. Skin type 4, you may get down to the 10 or 5, but you definitely need to test patch.
And for hair removal?
For hair removal.
For hair removal. On the Nd:YAG or on the Alex?
Yeah, on the Nd:YAG.
On the Nd:YAG. So you expand your skin type, your pulse durations for your darker skin types on the Nd:YAG?
Initially, for the very darker skin types. And then we'll test patch on those shorter pulse durations.
Shorter pulse durations. We tend to do that for the Alexandrite, certainly. But yes, with the darker skin types, with the Nd:YAG, I tend to follow really just the idea of the target size. So usually target size is large, so the hair is very thick, or in PFB or something like that. But otherwise, we'll start at 10 milliseconds or 5 milliseconds and drop accordingly. I've never gone higher than 20, so that's interesting.
Even in a skin type 6.
Mm-hmm. Not for the Nd:YAG, correct?
Yeah, no, for the Nd:YAG. I'm talking Nd:YAG.
Yeah. I've seen, since
for the Alexandrite, of course, I wouldn't treat the higher skin types with the Alexandrite for hair removal. So for a skin type 3, if they're tanned, then I would extend the pulse duration to 10 or 20 milliseconds.
Mm-hmm.
And then, of
that's
course,
very interesting. Yes, those test spots are important, very important. Well, thank you very much for all of your expertise and your time, and we want to thank the audience for joining us. We hope it's been helpful. I'm sure it's been helpful. And until next time, on behalf of all the team at Candela, we appreciate you, and we're wishing you a good evening.
Thank you very much.